Dementia, meaning, types, symptoms, and treatment. Welcome to the Ultimate Wellbeing. Ultimate Wellbeing is a health and well-being channel. The Ultimate Wellbeing Channel will help to improve your health and well-being. On this channel, you will see videos promoting good health and well-being that will assist you to improve your health and well-being to ensure your ultimate well-being. If you are new here, make sure to subscribe to our channel to get a regular dose of good health and well-being tips to become a better you for ultimate well-being. Relax, have fun as you see our videos and become a better you for your total well-being. Thank you. Dementia, meaning type, symptoms and treatment are discussed in this video. Now, let us start. Meaning of dementia. Dementia is the term used to describe the symptoms of several illnesses that affect the brain. It is not one specific disease. The most common cause of dementia is Alzheimer's disease. Dementia causes a progressive decline in a person's functioning and affects a person's thinking, behavior, and ability to perform everyday tasks. Dementia can happen to anybody. The risk of getting dementia increases with age, but it is important to remember that many older people do not get dementia. It is not a normal part of aging. Dementia can happen to anybody, but it is more common after the age of 65 years. When people between the age of 40 and 60 do develop dementia, it is called younger onset dementia. Early symptoms of dementia. The early symptoms of dementia are subtle and may not be immediately obvious. Common early symptoms of dementia include progressive and frequent memory loss, confusion, personality changes and behavior changes, apathy and withdrawal, and loss of ability to perform everyday tasks. Types of dementia. There are many different types of dementia. The most common include 1. Alzheimer's disease is the most common form of dementia, accounting for between 50 and 70% of all cases. 2. Vascular dementia is the broad term for dementia associated with blood circulation to the brain. 3. Lewy body disease is a form of dementia caused by abnormal structures in the brain called Lewy bodies, the symptoms of which can overlap with Parkinson's disease. 4. Frontotemporal dementia is the name given to a group of dementias caused by degeneration in one or both frontal and temporal lobes of the brain that often develops in people under the age of 65. 5. Alcohol-related dementia is due to excessive alcohol intake, especially when combined with a poor diet low in vitamin B1, thiamine. 6. Dementia caused by Huntington's disease is because Huntington's disease is an inherited, degenerative brain disease that affects the brain and body, and causes dementia in most cases. 7. Human immunodeficiency virus, HIV-associated dementia, HAD, is a form of dementia that is very rare. Diagnosis of dementia. It is important to consult a doctor when symptoms are in the early stages so that a medical assessment can confirm or rule out a diagnosis of dementia. A diagnosis of dementia will rule out other conditions that can be mistaken for dementia, such as depression, stress, pain, or infection. Trigger discussion of treatment options. Allow immediate early planning for the future, while the person affected can still actively participate, and allow support to be arranged that will assist both the person with dementia, and their carers and family. If the person will not go to a doctor, or the doctor is unwilling to take your concerns seriously, seek advice on how to deal with dementia. Conditions that cause symptoms like dementia. Some conditions have symptoms similar to those of dementia. In many cases, treatment of these conditions means that the symptoms will often disappear. These conditions include stroke, depression, some vitamin deficiencies and hormone disorders, alcoholism, medication clashes or over-medication, infections, and brain tumor. It is essential to get an early medical diagnosis, when symptoms first appear, to ensure that a person who has a treatable condition is diagnosed and treated correctly. Inheritance of dementia. Most cases of dementia are not inherited. Researchers still do not have a lot of information about genes involved in dementia. Some genes might be associated with different types of dementia, but in most cases, dementia is not caused by specific changes to a gene. Familial Alzheimer's disease does have a clear pattern of inheritance, but it is very rare. Symptoms can appear from the ages of 30 to 60. Researchers have found 3 genes that are associated with this form of Alzheimer's disease, but more genes might be found in the future. Alzheimer's disease associated with Down syndrome and the familial form of frontotemporal dementia is also caused by genetic changes. The involvement of any genes in dementia will depend on the cause of dementia, so it is important to have a firm medical diagnosis. If you have concerns about the risk of inheriting dementia, discuss them with your doctor. Treatment for dementia. At present, there is no prevention or cure for most forms of dementia. Support is vital for people with dementia, and the help of families, friends and carers can make a positive difference in managing the condition. While there is no cure, there are many practical changes that you can make, which will help the person living with dementia, and their family and carers. Some medications are available that can help to reduce some of the symptoms experienced by people with dementia, including cognitive, memory and thinking, problems and other associated symptoms, such as depression, anxiety and sleeping disturbances. It is important to remember that all medications have side effects. People with dementia might take some medications, and your doctor can help you to understand how the different drugs might interact with each other. Medications to help cognitive problems in dementia. Medications are available in many parts of the world to help with the cognitive, memory and thinking problems of dementia for people with Alzheimer's disease. These medications might also be useful for people with vascular dementia or Lewy body disease. The 2 types of medications for cognitive dementia symptoms include 1. Cholinesterase inhibitors increase the levels of a chemical in the brain that is important for memory, acetylcholine, which can help some people. 2. Memantine blocks the action of another chemical in the brain, glutamate, which can improve thinking problems in some people. Medications to help symptoms of depression in dementia. Many people with dementia experience depression. If depression becomes significant, it can begin to further impact memory and thinking. For this reason, it might be best to treat depression with medication, although it is important to minimize the side effects of medications to help symptoms of anxiety in dementia. Anxiety, panic attacks and unreasonable fearfulness can be distressing for a person with dementia, their family, and carers. Mild symptoms are often helped by reassurance, adjustments to the environment or an improved daily routine. More severe anxiety can be caused by underlying depression, and so antidepressant medication can help. Other options are antipsychotic or specific anti-anxiety medications, but these can have unwanted side effects and are usually not recommended for anxiety in dementia. Medications to help sleep disturbances in dementia. Waking at night and wandering can cause problems for both the person with dementia, and their carers and families. Speak to your doctor before using medication to treat sleep disturbance. If these are given during the day to sedate people with dementia, they can cause increased alertness at night. Getting help early will make a difference. The earlier help is found, the better the family and person with the condition will be able to manage and cope. It is important to plan ahead. While the person can still legally sign documents, get enduring powers of attorney to manage financial affairs, medical decisions and guardianship. Get information, find out about dementia and what lies ahead, so that you will be informed and have more sense of control. Seek support. Many people find it helpful to talk through what a diagnosis of dementia means and how they can adjust. Organize practical help. Organize help in the home, respite care, day trips and stays at day centers, which can all make a positive difference. Conclusion. Dementia, meaning, type, symptoms and treatment have been discussed in this video. Dementia is the term used to describe the symptoms of some illnesses that affect the brain and a person's ability to perform everyday tasks. Alzheimer's disease accounts for about 2/3 of dementia cases. Common early symptoms of dementia include progressive and frequent memory loss, confusion and personality and behavior changes. Early diagnosis is important as it enables early support, planning and support for people with dementia, and their families and carers. Medications might help with the symptoms of dementia, but there is no cure. Hope this video is useful and beneficial to you. We love to hear from you. Please post your comment below in the comments section. If you are new here, make sure to subscribe to our channel and press the notification button so you can get a regular dose of good health and well-being tips to become a better you for your ultimate well-being. If this video has been helpful and beneficial to you, then give it a thumbs up, share it with your friends and leave a comment below. Kindly note that any information on this video is provided for educational purposes only. Diagnosis and treatment decisions should be made in consultation with your doctor. Thank you. Thank you for seeing the Ultimate Wellbeing videos.